Hi, and welcome back to my channel. This is Tarsha Wiggins, licensed clinical social worker and certified alcohol and drug counselor. Thanks so much for clicking on my video. The topic today is anxiety and treatment options. As discussed in our last video, we talked a little bit about what anxiety is, and we also talked a little bit about does COVID-19 have you feeling anxious? So this is just a follow-up video to that. As in every video, you'll hear me say that this is not a video that should be used to, or the purpose is not intended for you to diagnose yourself or treat. Always consult your own behavioral health professional so that you can work with someone who's licensed and trained and it can help guide and direct you. But it's always good for you to go in armed with information and for you to have an understanding about maybe some changes within yourself. So the purpose of this video is to talk a little bit more about some of the treatment options available. The first option I'm going to talk a little bit about is one that we're not really going to spend a lot of time talking about, but that option being medication. There's various medications that can be paired together, sometimes anti-anxiety medication as well as antidepressants can be coupled together to help achieve a stabilized mood. So anytime we talk about medication options, that is something you definitely want to talk with your prescriber about. They want to definitely do some follow-up assessment analysis with you to determine kind of the onset, what's kind of triggered the anxiety, because that will help guide and direct the type of medication that they may want to employ or implement as a regimen for you. So definitely that is one option and something to be considered. And there's no harm or shame in that if that's something that's going to be effective for you. Another option, or kind of two options in one, that we're going to spend the most of our time talking about today, and that option being kind of self-care coupled with counseling and therapy. I think at this time, given COVID, and if you're a Wisconsinite, the Stay at Home Act or Safer at Home order that was just issued, most of us may be kind of confined indoors, and we may have to have some limited movement with getting connected with the behavioral health provider right now. So let's talk a little bit about what those treatment options are and what we can do to try to stay well. So when we talk about anxiety just in general, it's this overwhelming sense or urges or worries are usually the characteristics of that disorder. So when we talk about treatment options, really what we are looking to do is try to help lessen or reduce that. So some very proven, and you may hear me say in this video or future videos, evidence-based treatment modalities, which all that mean is it's been studied and it's been proven to be effective. So one therapeutic modality that has been proven to be effective is cognitive behavioral therapy. That's a treatment modality where behavioral health provider will work with the individual to kind of learn how to think through the behaviors, challenge some of the behaviors or some of the behaviors that's coupled with anxiety or the worry, and to learn how to dismiss those thoughts. Not dismiss, but in that process, you learn that your thoughts are maybe perhaps irrational, and then you learn that it's an irrational thought, which means it's not founded, it's not 100% true, so I don't have to believe this, I can think something other, and just kind of expanding the thought process around that in a very kind of simplistic way that breaks that down. So there is great work and information that can be done, and things and skill sets that can be learned in doing that. But what I'm hoping that maybe we can take a little bit more in terms of talking about good self-care and home care, and how do I manage this anxiety, because I think with COVID-19, most of us are probably experiencing this low-grade anxiety where we have this like worry, too much access for media consumption. It's like, well, what do I do with this? That thing we talked about in our last video about I got this worry and it's getting bigger and bigger in my belly. It's like, well, how do I try to keep that confined, and how do I make that smaller? So some of the tips I'm going to give you following this is hopefully things that you can employ to try to help make that bubble smaller in your gut. Okay, so one of the first things is we can do good stress management. Oftentimes I'm at home with my kiddos and working from home, so keep in mind stress management techniques, making a list, trying to stay organized to some degree, creating structure for yourself, not overcommitting. So just monitoring our stress level, monitoring our intake of things, and then also setting healthy limits and balances for ourselves during this time. We also want to try to couple or pair in that to mindfulness, rest, and relaxation. So when we talk about relaxation, sometimes we can do some good deep breathing techniques, grounding techniques, all things that you can Google or things that I can talk about in future videos. But essentially what that does, and that's also an evidence-based modality as well, is that when you're doing grounding or breathing exercises, what it does is it causes you to self-regulate. With the deep breathing, you're causing yourself to regulate. You're controlling, or to some degree you're calming your body in a sense of relaxation, and that's really important when you're constantly worried and you're feeling anxious and overwhelmed. So that might be a good thing we can talk about in future videos. Other things that we can employ right now is also looking at, are we taking care of our mind, body, spirit, and all those other components of us as well? So we should be thinking about, am I eating every 5 minutes? Have I gone to the refrigerator every minute, every hour on the hour? I'm not hungry, I'm not thirsty, but I'm just in the refrigerator eating, I'm in the cabinet eating. So let's be mindful about good diet and good exercise practices right now too. So definitely get out, get sun, walk, do something active, stop eating all the bad stuff in the cabinet, in the refrigerator. Make sure that we're following a good balanced diet at this point too. So keep those things in mind. Other things we also want to keep in mind, or ways to try to keep that bubble contained and our anxiety at bay, is limiting our access to the stressor. So maybe you need to turn your phone notifications off. Maybe you need to not watch CNN all day. Maybe you need to not watch news media outlets all day, period. Maybe you need to just confine that time so that you're not constantly being burdened or consuming the thing that's making you stressed, or causing your source of anxiety. Let me label it that way. Your source of anxiety. Reduce your access to the source of anxiety. That's one thing that'll help contain it, get that bubble smaller in your gut. So that's just something else that you can try. And also, we want to utilize our good social supports right now. So if you have to FaceTime, Snapchat, or any other means of communication, text messaging with good, positive people in your life, do that. That's helpful for you right now. I always say laugh, laugh, laugh. It reduces natural endorphins in our body and our brains. That makes us feel good. So definitely plan those funny movie nights with good, funny videos or movies. Also, take part in some of the other positive social media things that's going on right now with the live streaming of concerts and good fun family time. Other things I would highly encourage right now too is a good prayer life. If you're a believer, prayer can be incredibly helpful right now. Meditation or meditation on God's word also can be very stress relieving, giving you that, restoring that sense of hope, something greater than you, something bigger than you. So all of those things are also really helpful during this time. And then at the end of it all, reflect back on your day. Look over your day. Look at the progress that you made. Look at the good things that are to come. Maintain your hope, and look at the peace that you do have in your life right now. So all those things coupled together should ultimately help you make it through a difficult time where you might be experiencing some anxiety. So I hope that you found that this video was helpful. Please like, subscribe, and check out my future videos to come. And at the end of the day, let's all go out. We can conquer this. Let's just be educated. Let's be informed. Let's reduce the stigma around mental health. Thanks so much for checking out my channel today and my video. And those were your mental health minutes.